Hello, my name is Hamare Santo, working with my mentor Ilana, presenting from Edmonton, Canada. My topic is, in what ways do race and ethnicity affect the nature of association between social media use and mental health in adolescence? Quite lengthy, I know, but after hearing all the detrimental misconceptions about mental health in my diverse community, I knew that researching this topic could spark a very much needed impact here. So firstly, we will look into some overviews of mental health and social media over the years. One study observed that over 10 years, an additional 33% of American youth in their sample gained more levels of depressive symptoms. Even racial and ethnic minority children are more likely to receive poor mental health support in this next study, which could explain why such disorders are prevalent among minorities yet hardly noted. And this now brings us to my first two background questions. Firstly, is there a relationship between social media use and mental health? Well, possibly. In this 2019 study, adolescents may have a doubled risk of depression and anxiety symptoms with over 3 hours daily on social media. And if so, secondly, which one affects the other and how? So both social media and mental health may affect each other, but no reliable information explains which one is the primary aggravator. Instead, we have the displacement hypothesis theory, which explains that high social media use can predict mental health issues. We also have the uses and gratifications theory, which has the inverse definition. And we also know the differences in mental health rates by race and ethnicity. And though we should be cautious about the intersectionality between factors like race, culture, geography, and socioeconomic status, my hypothesis is that race and ethnicity may affect the strength of the relationship between social media use and mental health. And now as for the results, but before we get into that, we have question 3. Is there a relationship between race and ethnicity, social media use, and mental health? Well, in one study, mental health indicators and screen non-screen activities may have partial correlations with race and ethnicity. And in another, race and ethnicity was unrelated to the social media variables, such as the apps used, frequency of use, etc. So there's no clear answer, but most studies suggest a relationship between them. But this may reach the extremities of suicidal outcomes and externalizing behaviors. We can see that in the diagram where Hispanic adolescents who regularly used Instagram had a higher chance of externalizing behaviors. Even in Brazil, Black adolescents who did not meet the behavioral targets, which include reduced screen time, had higher suicidal ideation. And here, online racism and discrimination may make non-white youth more prone to poor mental health. We see that in Tao's study, where increased social media discrimination correlated to increased depression and anxiety. We can see that all questions were answered to some level, but let's answer the research question. So there was a common suggestion among all studies that racial and ethnic experiences, like online discrimination and viewing traumatic race-related content, may be a significant way that race and ethnicity affects the association between social media use and adolescent mental health. But since race and ethnicity often overlaps with factors including culture, geography, and socioeconomic status, future studies must remain cautious about other individual experiences. So the changes made to future studies regarding this issue could promote beneficial change here and beyond. My name is Hamare Santo. Thank you for watching my presentation.